Hi everyone, I am Arinder and I have been working in health tech industry for more than 20 years now. Over a period of 20 years, I have architected and developed 80 plus health tech apps, which have been including ambulatory EHR, remote patient monitoring, and various other healthcare applications like appointment scheduling and anything which is actually helping out the patients. Today, I wanted to take out my time to share my experience in building healthcare products and what you could be doing and what you could be considering while building a healthcare app. So first and foremost is going to be different definition of a target audience and the purpose of app. So basically the apps actually consider three broad categories. One is patient, second is healthcare providers, and third is general wellness apps. So talking about the patients would be more about appointment scheduling, medication tracking, symptom checker. So whichever basically patient is actually using those apps for. Healthcare providers, as you can understand, they are more concerned about communication with patient or communication with different healthcare providers, EHRs, telehealth. So anything which is actually helping out in their profession. Third category of app is general wellness, which is fitness tracker, diet apps, mental health support, which is more or less your consumer apps, which are not concerned about a disease or something like that. Those are more about your general category of apps. So while you have actually identified the need of the app, so first and foremost is going to be doing a market research and consulting healthcare professions. So while you are actually consulting healthcare professions, this would actually help you in pinpointing the gaps in existing services. Once you have done that, you could be looking at the areas in which the app could be improving efficiency, communication, or patient education. Even though I'm actually talking about these broad three things, it's not necessary that your app could only be these three categories. So since the innovation could be in anything, so these are the primary three categories, whereas your categorization of app, maybe you could come up with something new. One thing that you need to consider while building the app is going to be security. HIPAA compliance is the one which actually scares people. People get scared just hearing about meeting the compliance requirements in the US. HIPAA regulation actually is meant to safeguard the patient data. It's not just to scare you out. This can lead to, even though it can lead to huge fines, security is paramount while creating healthcare application. HIPAA compliance is crucial. This means architecting robust data encryption, using secure user authentication, defining and clearly meeting the data privacy policies. Security would also need to be covered in detail while building the hosting environment and also while defining the complete architecture and your hosting related infrastructure that you have. Choose the third-party applications in a way that they are actually meeting your HIPAA related acts. Signing a business associate agreement with these third-party applications is paramount. Research and adhere to all relevant regulations for your target audience and location. And for this, do involve your legal counsel to ensure these compliances and also make sure that you are actually documenting these. Another thing to actually consider is actually going to be UX design. Prioritize a clean and intuitive interface. Hire a good designer who can actually define the UX for you. The accessibility is going to be paramount. Again, accessibility, what I mean by accessibility is meeting on that the patient with various disabilities can use your app. The app should be easy to understand and should not be creating a stressful situation for your users. Balance on functionality and user experience. I know that most of the time we actually tend to think about functionality first, but while building the functionality, it is very, very important that you also keep user experience in mind. Complicating the user interface by adding multiple things actually can lead to stressful environment for the user and unnecessarily basically complicate the things for the user. Focus on core functionalities while avoiding overwhelming the users. Use calming color templates, simple layouts, positive messaging, so that you can reassure the user experience that the user actually has. Another thing that you need to basically keep in mind is integration related requirements that you have. Your application cannot live in standalone environment. That's the reality of health tech. So your application should be scalable, while handling the user bases. It should also be able to easily interoperate with your different EHRs, various other systems that the user might actually be using. Specifically for healthcare providers, it is very important that your application integrates with EHR, your practice management systems, or any other system that your provider might be using. Another thing that you'll also want to consider is building an MVP first. Don't rush into building the complete requirement in one go. Build a minimum viable product, take that to the market, test the core functionality with the real user, gather their feedback, and refine them before doing the complete deployment. Even before doing the deployment, you might actually, so even though we say MVP as one stage, I'll recommend that you actually build application using multiple MVP models. Build the MVP, launch it, build small more features based upon the user feedback, launch that again, and do that as an iterative approach. As we talk about future of healthcare apps, there are emerging trends that are there. So wearable data integration has been paramount for any of the users that are there. You might want to also basically think about telehealth advancements that are going on, remote consultations, your remote patient monitoring, and using of AI. So you still need to consider that AI cannot replace any of the providers or your healthcare professionals. So AI you still be using for personalized healthcare recommendations, but those should purely be limited to recommendations for now. AI is not to replace any of the healthcare professionals. Even though the future is actually AI, but be very, very, what should I say? So it should not be overly just use of AI that you want to sell out. Apps can prompt healthy habits, track vitals for early disease detection, and offer personalized recommendation based upon user data. But again, these are the use cases which are generally there. There might be another use case that you want to bring up in the market, and you might be better judged to actually do that. So while you are doing that, do get a recommendation from various healthcare professionals and your legal counsels whether you are breaching or basically doing something which is not legal. So covering about the tips, again, as I previously said, if you look at, there are challenges that you are going to face. So specifically related to data security, your design. So if you're keeping these things in mind, what I actually previously covered, you should be well covered. But yeah, in any case, if need be, you can always reach out to experts in various areas. So for legal, go on to the legal counsels. For your technology, you might want to reach out market leaders. You might want to reach out CTOs of the companies who might have actually done similar applications, or your healthcare professionals who are there, or whether you are actually meeting those requirements or not. So clearly define your app's purpose, prioritize user needs, and build a strong development team. While doing that, also ensure that you are meeting and complying all legal regulations. So in the next topic, I'll also try to cover a few more things related to HIPAA compliance. But yeah, for this particular video, I think that's going to be it for now. So yeah, thank you so much.